We have 3 children. All 3 have been diagnosed on the spectrum in some form or the other.
Kamaka Randall will be the first to tell you there's no perfect way to navigate an autism diagnosis. Her kids are now 23, 18, and 12. The younger 2 diagnosed as toddlers.
We thought we were on an island by ourselves. You know, we didn't have anyone else in our family that had autism, didn't know what it was, wasn't really talked about in the Black community. And so when we were able to connect with other families, it was like, oh, I found my tribe.
Randall and her husband started the Black Autism Support Society to connect with families with a similar experience. And here's why this was so important. Nearly 1 in 50 children have autism. A CDC study shows that the rates of autism amongst Black and white children are about the same. But African American children are typically diagnosed much later, at one point almost 2 years later. But thankfully, a lot has changed.
10 years ago, we didn't know what to do with autism. Now there are treatments. There are forms of autism that can be treated.
Dr. Luis Escobar says that he sees about 20 to 25 new referrals a week at Peyton Manning Children's Hospital. But that's encouraging, he says, because it means more parents are seeking help, and sooner, which is crucial. But he knows the playing field still isn't level for everyone.
They don't have the opportunity to access those providers that will help them with the diagnosis and treatment.
And that's why Randall says it's important to shed light on why so many Black children on the spectrum are routinely misdiagnosed or not diagnosed at all, like disparities in healthcare, lack of parent education, and the stigma or fear of being labeled. She's familiar with all 3, but in breaking the stigma,
It's okay for them to have this because it gets them the help that they need.
Randall says she was able to get that help for her younger son and daughter much earlier than her oldest son. And she hopes to help other families do the same.